How is maintenance therapy adapted to myeloma risk?
Risk-adapted maintenance therapy is the idea that you want to give an optimal therapy at the front end of treatment, so in induction. But what we know is that many high-risk patients may get into remission, but keeping them in remission is the challenge. And so our group, about almost 10 years ago now, took on the idea of treating high-risk patients with 3-drug maintenance, using their genetics to drive the maintenance. So if they're standard risk, our approach would be to use lenalidomide alone. If they're high risk, then our approach is to use RVD, and we give 3 years of RVD-based therapy. And if patients can make it that additional 3 years, we then go to lenalidomide alone. So risk-adapted says taking their genetics up front and using it to tailor the maintenance. Our group for at least a decade now has been doing the idea of triple drug maintenance for high risk, bortezomib or proteasome inhibitor-based maintenance for the 414 subset, and then lenalidomide maintenance for everybody else.
So when you actually look at, I think that the group that studied this the best with lenalidomide was the MRC, and what they showed was actually lenalidomide maintenance therapy by itself has activity in high-risk disease, whether you look at deletion 17p or 414. So I think that there's this misconception that lenalidomide does not work in high-risk disease, and that's just simply not the case. That said, patients with high-risk disease don't have as durable remissions with lenalidomide maintenance therapy as patients who have standard risk disease, so we can certainly do better. I think, where most of us are going with maintenance therapy for high-risk patients is combination maintenance therapy as opposed to one agent versus the other. But I think many of us do believe that there's an important role for proteasome inhibitors in patients with high-risk disease, particularly those that have myeloma that's characterized by the 414 translocation, and those patients who have deletion 17p. Those are cytogenetic abnormalities that seem to respond particularly well to proteasome inhibitor-based treatment.